Hi, my name is Dr. Raja Adnan Ahmed, and I'm a psychiatrist. I work in UK. Now, this video is part of my NHS job interview series, which I'm making specifically for the international medical graduates. And I'm trying to explain some of the commonly asked questions which you may encounter in an NHS job interview. Now, remember, I'm not trying to give you any model answers. This is just to explain the concept behind those questions. What is the panel trying to ask you? And you have to come up with your own answer, with your own experience, and with your own individual personality. So let us tackle another commonly asked question. So let us tackle a commonly asked question, which is about conflict. So this could be asked in different ways. They may ask you that what is your understanding of a conflict and how do you manage it? They might ask you to give an example when you were involved in a conflict and how did you manage that? Or they may ask you that tell us about a difficult situation you have been in. And in that difficult situation example, you can also talk about conflict because conflict in itself is a difficult situation. So, what is conflict and how can it happen in a medical setting? So, a very simple definition of conflict is that conflict is a disagreement, clash between ideas, individuals, or principles. And again, conflict will have different types. The conflict may be between the two team members, two healthcare staff members. It could be between an individual and the senior. It could be between a patient and a clinician. So we have to understand where is the conflict, and when we're giving an example, we need to be clear that which area this conflict is covering. Then conflict can have also different types as well. The three common types you may see is that the task conflict, the process conflict, the relationship conflict. The task conflict, for example, may be about you undertaking a task with a team, and there's a conflict between the team because the task is conflicting with their values, the task is conflicting with their daily work. A process conflict would be that there would be a process to follow, but you are unable to follow, or the other members involved in that conflict are unable to follow that process, and it is coming to a clash. A relationship conflict is, for example, if there is relationship clash, there is a personality clash between two individuals, and they are not able to get along. They're finding it difficult to work as a team members. So now the question is that how would you identify and solve a conflict? Now there are different ways and different methods which will be explained. And if you go on internet and try to find out a healthcare conflict, how to resolve healthcare conflict, conflict resolution, NHS, if you use those keywords, you will get several examples, several training modules as well, sometimes PDF files where you will get some explanation. But very simple way to explain conflict resolution is that first you need to find out where is the conflict. So just because there's a personality clash, or because people are arguing between each other, that is not enough information. Sometimes you have to actually step back and sort of gather more information that what is the root cause of this conflict, where is this conflict coming from. So you may be a party to the conflict, it may be conflict between you and a patient or a family or another team member, or in that conflict, you may be a third person observing a conflict. Now, it is very, very important to mention that the issue with healthcare conflict is that the conflict between team members or between the healthcare staff and the patient can lead to compromise of the patient care. It can lead to poor patient care. So we have to, if whenever we actually see a conflict happening or starting to build up, we must act swiftly. We must try to ensure the patient safety is not compromised. So the first thing, as I said, is to identify where is the conflict coming from. For that, you need more background information. You need to understand what has been happening. Second stage would be to engage the different parties who are involved in the conflict and try to understand their perspective. So try to, in here, you will need good communication skills. You need to be very open. You need to be asking very open questions, and you need to have very good listening skills as well. The parties should be feeling confident that you are there to actually help and solve and overcome this conflict, and they should be able to openly talk to you about what's been happening. After understanding and getting background information about the conflict and speaking to the party, you may be able to define, you may be able to narrow down where is the conflict, identify the actual areas which are leading to the conflict. Now, the fourth stage would be to actually search for solutions. And now at this stage, when you are searching for solution, I believe it is ideal if you involve the parties involved in the conflict to look for solution as a team. You might not be able to, if the conflict is very significant, you might not be able to sit together and look for solution at the same table, but you can go away and think of solution and then share with between each other and say, what are the possible solutions? How can we take this forward? The reason we involve everybody to try and find solution, because if a solution is found by the parties themselves, they might find common solution, and if they are finding common solution, they may be more signed up to it. They may be getting more energy and motivation to actually work on those solutions. And the final stage would be to agree on the workable solution and then implement that. Now, for that, you may need to monitor it, if this is working or not, if this has been practical or not, or if there needs to be some more changes made. Now, remember these 5 stages. Number 1, gathering more information. Number 2, understanding the point of view of different parties involved in the conflict. Number 3 is to define the problem and what is the issues causing the conflict. Number 4 is to coming up with solutions. And then number 5 would be to implement those solutions and then monitoring the situation. But often in the NHS job interview, when you ask questions like this, a better way to answer them would be to actually come up with an example. Or the panel might directly ask you that, give us an example of how you confronted and solved the conflict. So I think it's always important to have an example in your mind. Now, the example, I would always recommend people to go with two different examples. One example may be between the healthcare workers. So if you're a junior doctor, it may be conflict between a junior and a senior, or among the junior doctors. A second example would be should be about conflict between doctor's point of view and the patient's point of view. Now, let me give you a very simple example, which happens all the time between junior doctors, what we call the rota management. So junior doctors are working on rota, and different doctors are listed on that rota and doing different hours of duties in the hospital. So a conflict might arise when the one group of junior doctors or one doctor start believing that they are actually doing more work than others, and others are not doing their share of work. Now, you can see that can lead to some personality clashes, that can lead to some maybe harsh words exchange, that might lead to difficult and challenging situation between the colleagues, and it might affect the teamwork. So again, if you apply that if you're one of those doctors who's trying to solve this conflict, you apply the 5 stages I talked about to gather background information. Is it true that one doctor has been given more duty hours than others? Number 2 is to listen to the parties involved. Listen to the doctor who's making complaint. Listen to the other parties involved. Number 3 would be to actually identify the problem, and then where is this problem coming from? Is it just an idea they have developed in their head? Is it true that there are some issues with the rota management? And then come up with a solution. Ask both parties to actually think of solution and then try to implement those solutions. So if you show that you have managed a conflict, you have managed a rota where the doctors were not getting along with each other, and there were conflict arising from that, and you were worried that that might lead to poor patient care because of the high express emotion among the team, that will become a good example of conflict management, and how you actually involve yourself and how you change that working practice. Conflict between doctor and patients or patient's family is also very common. So like, for example, if you as a doctor, you have prescribed a treatment to the patient, and the patient does not agree for that, and the patient is asking for a different treatment for that condition. Now, this is a very, very simple example, and this sort of thing happens all the time. So how do you resolve that conflict? Again, try and understand what has been happening, gather more information, what has been prescribed, what has been the diagnosis of the patient, and what was given to them. Develop a good communication skill with them, asking for their point of view and getting the point of view of doctor as well, and explain them both in very simple terms that what has been happening. Identify the problem, identify and find some solution to it. So this type of conflict between the doctor and patient or their family can lead to poor patient care, because the doctor might be prescribing a treatment, the patient may not be able to adhere to that treatment because they don't believe that is the right treatment for that. So in this type of conflict, good communication skill is very important. Acknowledging patients' distress, acknowledging their ideas, their concerns, their expectation, and then explaining the doctor's point of view of why they have chosen certain treatment, why are they recommending certain treatment, if there is a way that the treatment can be adjusted according to the patient's wishes, or would that be in the best interest of the patient, would that be the right form of treatment, can that lead to any harm or not. So all those sort of things are important, and that can lead to resolution of the conflict, and that can lead to a good patient doctor relationship as well in the longer term. So thank you very much for listening to me. Just remember the definition of conflict and the different types of conflict and how to solve a conflict. And then have some examples ready. One example between a doctor and patient conflict, and one example between a doctor and the colleague conflict. And by doing that, I hope you will be able to tackle this question very well in an NHS job interview, and good luck. And I hope to see you in another video. Thank you very much.